The Caribbean Public Health Agency, CAFA, has issued an alert for the region, putting us on standby for a possible outbreak of dengue here in the region. Of course, they have an outbreak in Jamaica, and we have one recorded case here in St. Vincent and the Grenadines. The Ministry of Health has moved to put us on alert to prevent any further occurrence of dengue here in St. Vincent or to prevent an outbreak. What do we do? What measures do we take? How are we handling the situation? To answer some of those questions, I have with me Dr. Jose Davy, the Registrar with the Ministry of Health, Wellness and the Environment. Dr. Davy, good day and welcome to the API.
Thank you, Ms. Richardson. I'm happy to be here.
Okay. Now, usually when we hear dengue, we perk up, we listen. Sometimes we take action, sometimes we don't. That's the normal person, citizens of St. Vincent. Before we go into what measures we should take to prevent an outbreak of dengue here in St. Vincent, could you just explain for us what dengue is really?
Sure, with pleasure. Firstly, we must note that dengue is endemic to St. Vincent, which means we always have dengue circulating. Dengue is a viral illness, and it's spread by the vector, the Aedes aegypti mosquito. So this virus is with the mosquito. It bites someone, transmits the virus, and that sick person, after going on and being ill, another mosquito comes, bites the person, and bites someone else, and they may contract the disease. So it's 5 viruses in total, dengue 1, 2, 3, 4, 5.
I note that the CAFA really said dengue. Usually we hear dengue fever. Does it always come with a fever? What's the difference?
Okay, so when we look at the classification of dengue, this has caused a lot of trouble internationally, and now they're down to defining it with 3 special items. So there's dengue fever, which is non-specific. Then there's dengue with warning signs, and there's severe dengue. So a person may have one of the 3 or may pass through 3 of the phases. So it really depends on what's happening to the person clinically as they progress with the illness. As with any other illness, some persons may have a mild form of disease and others may have a severe form of disease. So that's where all of the confusion comes in. How do we classify dengue? What's really happening? But all it really is what's happening with the patient at that particular time.
Okay, so how do we know when we have dengue? What are the symptoms to look for?
And this is, again, where the confusion sets in, because dengue starts off very much like all other viral illnesses with your fever. And the fever is usually quite high, 40 degrees, around 38 to 40 degrees. There is headache, and this headache is usually behind the eyes. It doesn't always have to be behind the eyes, but usually it is. There may be some redness in the eyes. When we speak of the abdominal pain and the vomiting, that's when we know something is going wrong. That's when we get to the critical phase of dengue, and where things can go wrong if you don't recover well. So there's also back pain. Back pain is very severe, muscle pain, joint pain, but not as extreme. The joint pains are not as extreme as that experienced with chikungunya.
And that is spread by the same mosquito?
The same mosquito.
Now, who is most affected? Are we all vulnerable, or do we have a particular section of the country, who might be more vulnerable than?
Well, the sections of the country that will be more vulnerable will be those who live next to the swampy areas where there's heavy breeding of mosquito. But generally, we are all at risk, especially those who spend most of the day outside, because this mosquito is a day-biting mosquito. It bites you in the morning.
Oh.
Yes.
It has a preference for morning.
Yes, it does. That's when it's alive and awake.
If you suspect that you have contracted dengue, is there anything you can do at home? What is the best way to treat it?
Firstly, there is no cure for these viral illnesses. The best measures to take would be to stay hydrated and to take paracetamol. We want the public to avoid taking aspirin and ibuprofen, because these treatments can lead to further bleeding on your inside. So really, when you experience all of these initial symptoms, you should come to your doctor so we can get your test and we can prevent the complications of dengue.
Is there a vaccine you can take for dengue to make sure you don't get it?
Unfortunately, no.
No vaccine.
No.
Now, having recorded one case of dengue so far, how concerned should we be here in St. Vincent that we can have a possible outbreak?
Well, that's one confirmed case. Remember, you can have other cases that the persons never came forward to take a test. So there are, of course, environmental measures that you can take to avoid the breeding of this mosquito. Wherever water may be scattered or maybe accumulated, for example, in tires that are not in use, pots, flower pots, vases, the guttering, the siding around the house. You need to check on those to make sure mosquitoes are not breeding in those. Those uncovered drums that we have, we need to check on those as well. Anything that may accumulate water, be it rainwater or natural water. And I think the other day they even had a problem with the septic tanks, those that weren't sealed properly. Mosquitoes were breeding along that. So they just need a tiny bit of water, really, to breed. So if we can take care of all of these aspects, then that's one way of diminishing getting bitten. And of course, you have protective clothing, so you stay in longer clothing. You use insect repellents, and if you have mosquito nets, that would be great if you can use mosquito nets as well.
How long does it take for the symptoms of dengue to show?
From bite to being ill, from 3 to 14 days.
Okay, so it takes a little while to set in.
Yes, 3 to 14 days.
By the time you get to 3 days, you're very sick?
You can be very sick after the third day. But the disease goes into 3 phases. There's the febrile stage, which we call where you have fevers for about 72 hours, 3 days. There's the critical phase, which is about another 2 days, and then the recovery phase after. So in total, it should be 7 to 10 days.
Is dengue deadly?
It can be. And that's why I was encouraging the public to avoid things like ibuprofen and all of these other drugs that may increase bleeding on the inside. Because what happens to you is that your blood vessels actually leak out on the inside of you, causing bleeding on the inside. So the rash that we see in dengue, it's actually little spots of blood under the skin.
Now, if there is an outbreak of dengue in St. Vincent, should it occur, are we prepared to handle it from the Ministry of Health perspective?
We are, because remember, there is no treatment per se. It's just a matter of controlling the fevers and the symptoms and administering IV fluids for those who are severely ill and monitoring their vital signs. And for persons to know that all you really need to do is to stay hydrated, keep your fevers down, and you should be good.
Okay, what other plans do you have from the ministry in place to really heighten the awareness among the public that this is serious business? We need to take precautions, and we really need to take control of the way we handle our environment. What other things you have in place? Do you have like an awareness program, something else you can do?
Yes, the health board, the health information system in the Ministry of Health, they're gathering all their equipment. There'll be health word. I imagine that they'll be going to schools and talking about this. I know we have old posters up. Maybe some of those would be revised and revisited. And also from the vector control unit, they'll be continuing their fogging, because the fogging doesn't stop. And they're doing that right now, the fogging of adult mosquitoes.
Okay, are they going to be, well, you probably don't know that, but would they be going throughout the country, or are they starting at various points? Where are they starting?
What they usually do, they take mosquito indices, where they go and see where the area of most mosquito breeding, and they start their foggings in those areas, and then they move to the others, including the grenadines.
So as a people, we need to tidy up a little bit more around the home.
Yes,
clean up the
those
gutters.
Coconut shells, those empty containers that you have lying around. Well, if you don't litter in the first place, then it's easier.
Okay, and we know we have a problem with littering.
Yeah. So if we don't litter, it's much easier for everyone involved. Clean the beaches, don't leave your garbage on the beach. It's easier for everyone.
Simply put, don't leave anything around that can catch water.
Correct.
Clean up the environment.
That is so.
And that way we can get rid of we could
breeding.
prevent the breeding of the mosquitoes,
yes.
and therefore be at less risk for dengue.
Correct.
Anything else regarding the dengue situation that all people should know that you need to tell them?
As I was saying previously, if you feel ill, you're having abdominal pain, you're vomiting, you really should come to the doctor because it may be a case where it's getting severe. Don't stay at home and think that everything is going to resolve on its own.
Now, if persons need more information regarding dengue, what they should do, how to prevent it,
they can go
what
to
should
their
they do?
local clinic, the district clinic, or they can call the hospital's number 456-1185. The operator would put you on to someone. Yes.
Okay. Well, let us hope that our people heed the warnings, that they clean up, and that they recognize that if we don't keep our environment clean, that we're putting our own selves at risk for this dengue, and it can be deadly.
Yes, it
So,
can be.
Vincentians, you heard it. Clean up the environment and let us keep us safe and healthy. St. Vincent and the Grenadines. Dr. Davy, thank you so much for joining us today, and have a good day.
You're most welcome. Same to you.
Thank you.